So for people that have had maybe like a lumbar fusion surgery or some sort of back surgery, and they're still having pain,
Right.
you treat those patients with a lot of results, good outcomes.
Absolutely. And the good thing about the laser that we use, there's no side effects. So even if you've had a fusion surgery and you've got hardware, you've got screws in there, the laser will not bother that.
Okay.
What it does, and especially with patients that have multiple surgeries, they're going to have scar tissue. They're going to have some nerve irritation. Even if the surgery was successful, there's still going to be scar tissue there. And we see a lot of patients that have had repeated surgeries just get to the point where they don't want to do another surgery. So we're using, the high intensity laser. We're using sometimes that in conjunction with spinal decompression. We've got a couple of FDA cleared medical devices that will have patients do some of their treatment and therapy at home to help with the scar tissue and retrain the nerves so they're not firing those pain signals at home there too.
So have you had people that actually, of course they had the surgery, they're still experiencing mild pain, where that pain is gone or almost gone?
Yes, absolutely. And even with a very successful surgery, and patients get spinal fusions, and it does the job of fusing that area and making that stabilized, but you still got the issue with the scar tissue. The other issue with post-surgical is most of the time the patients will have some degeneration or arthritis at the areas above or below the surgery, and the surgery did great, but now they're having the issues with the scar tissue inflammation, because those areas now have to do a lot more work in order for you to be able to move after the
So
surgery.
you treat the above. So if it's spine, if this is the middle of the spine, you're treating below and above.
Yes. With the fusion, typically, we'll be treating above and below to maintain
With
the
the
mobility
laser
there with
and
the
these
laser.
other things.
Yes.
And people feel better.
Absolutely.
Is it measurable? I mean, where they actually tell you, I feel better.
Yeah, absolutely. And we see them.
Can it last a little while, or is this something they have to kind of get little touch-ups on over the years?
It depends on how severe it is. Now, with the laser itself, the laser is actually healing and correcting the problem rather than just covering up the pain. So, if you're taking a pain pill, once the pain pill wears off, the pain's still there, the problem's still there. Injections, for the most part, same thing. Once the injection wears off, the problem's still there. The inflammation may have gone down, but this actually changes.
Because the laser
heals.
helps you regenerate some tissue?
It helps heal damaged tissue from the inside.
Okay.
So if you've got damaged nerve cells, inflammation, that laser will go in and stimulates those cells to heal themselves.